It's really good to have you here. You're welcome to hashtag GTV Breakfast.
Thank you.
First of all, tell me exactly, what does a mental health assessor do?
Okay, with a mental health assessor, what we do is we assess people with mental health issues, and depending on their diagnosis, we signpost them. If they need to go into hospital for treatment, we send them into hospital, and it depends on the diagnosis. Some of them could be drug-induced psychosis, some of them could be drug and alcohol, and different diagnoses. So depending on your diagnosis, we signpost you for further assessment and treatment.
Okay, so you're like the first stop.
Yes, we are like a first point of contact, and we normally work in A&E, accident and emergency.
Okay.
Yes.
So what exactly is dementia?
Okay, when we talk about dementia, I don't even know where to start from, but really it's the word dementia. We've got Alzheimer's, and Alzheimer's is what progresses to become dementia. And when we talk about dementia, we've got different types of dementia. Dementia is a disease that affects the brain, and what happens is when you get dementia, the neurons in the brain is not connecting to the cells, and what happens is part of the cells dies, and when it dies, that is when your behavior and your behavior changes, and your ability to think, your ability to do things gets affected, your way of thinking, your way of seeing things, different presentations when the brain becomes affected. And it's so sad that when you get dementia, it's something that is not, one, reversible, or is not treated. You can't treat dementia. The only thing that can be done is you can delay the progress of dementia, but dementia is not treated. And one good thing is, when is it detected at the early stage, that is when something can be done about it. And even with that, it's not cured. The only thing that can be done is to delay the progression. They've got medication that can delay the progression of it, but unfortunately, it's not cured. That's one thing with dementia.
Is it linked to memory loss as well?
It's linked to memory loss. It's linked to forgetfulness. It's linked to different types of, behaviors. Your behavior can change. You can become very paranoid. Sexual disinhibition. So it comes with a lot of things.
What is sexual disinhibition?
Sexual disinhibition is, how should I explain it? So you become more sexually attached to people, and it's because of the brain that is not functioning properly. So you see someone, and then you become attached to the person sexually, trying to, how do I put it? I don't want to. It's like you're giving yourself to the person without the person wanting you, so you force yourself onto the person sexually. Yeah, just because the brain is really not functioning properly.
How common is dementia in the population?
Oh, dementia is very common now, very common. And to your surprise, you could see that even the young ones are getting it. And most of the young ones that are getting it, most of them, one is to do with genetics and consumption of excessive alcohol. The young ones that are getting it mainly is from alcohol. So we've got different types of dementia. We've got frontal lobe dementia. We've got vascular dementia. We've got Korsakoff dementia. The Korsakoff one is the one that is linked to alcohol. And then we've got Lewy body dementia as well. So we've got about 5 or 6 different types of dementia and their presentation.
What are the early warning signs?
So the early warning signs of dementia, one, you see behavior changes. The person becomes very paranoid. This person will think you're talking about them, you're doing things against them, you're plotting for them to be killed, or these are some of the signs of dementia. Forgetfulness. The severe one, you will see your own son or daughter and you wouldn't be able to recognize them, which is very sad. This person might see the son and she'll be thinking, oh, this is my husband, whereas it's the son.
Yeah.
So severe forgetfulness, inappropriate behavior, thinking ability, not able to think properly. Even some of them lose the ability to eat. Incontinency, they are not able to hold themselves properly. So it depends on the part of the brain that is not working properly. Is the cells, part of the cells that dies. And most of it, part of the brain, the cells that dies, lack of oxygen is also one of it. Lack of oxygen is not going properly to those places because of the deficits that is coming into the brain. So depending on the parts that is not working properly, let's say if the parts that coordinates your ability to use the toilet, to eat, if that place is affected, then your ability to eat is gone. Unfortunately, you have to be fed.
Wow.
Yes. Incontinency, you have to use incontinence pad. So depending on the part of the brain that is being affected, that is the behavior that you put up.
When my dad entered his early 60s, for some time he would ask you for something and then we'd tell him where it is. And he'd come back and ask you again.
Yes.
And he'd just keep asking the
Yes.
same thing all over and and we were getting frustrated. and little did we know that was the beginning of dementia, right?
Yes, beginning of dementia. They will place something somewhere, and then after a few minutes, they will come to you and say, oh, I placed this here. Where is it? Oh, no, they will start accusing you. You've taken it. Where did you take it to? No matter how you explain to them, it's still the same thing. They stand at the same place that you have taken it. And all these things are warning signs of dementia, very forgetful. They go out sometimes, they can't even locate their way back home.
It happened to my dad. He was missing for about 12 hours.
Oh, wow.
Yeah, but we found him. Yeah, which was a miracle because I understand there are some people are never found.
Yeah. Okay. I don't know the situation here in Ghana, but back in the UK, if someone gets missing, the first thing is to circulate to the police. If you circulate to the police and you explain what they are wearing and everything, they find them within 12 hours. They are found. But I don't know the system here.
Here we call the radio stations first, and then call the police as well. And most of the time they find them, but on some rare occasions they don't find the people.
It's so sad.
Yeah, it's really sad. So that's just forgetfulness. You've forgotten your way home.
Yes. I quite remember I had a neighbor, an old lady, and she always misses her way and come to my door, and I'm next to her. She'll come to the door, knock on the door, and she'll start laughing. The moment I open the door, she's like, oh, sorry. And sometimes it got to a point where she was coming out naked.
Ooh.
Yes, I had to alert the police, alert the family that, she's not able to care for herself anymore, and she needs to go to a nursing home, 24-hour care, where she can be cared for.
Was she living alone?
She was living with a demented husband as well.
Oh, boy.
Yes.
Both of them were demented?
Both of them were demented.
How old was she?
She was in about her 70s, I would say. And the husband was an old soldier. So some of them, they like their own comfort and they don't want to move, unfortunately. So I think that is what really happened. And they were living alone by themselves. So.
Will all of us, if we live old enough, long enough, will we all get dementia?
Not really. Although there will be some few bits and pieces of forgetfulness, but when it comes to real dementia, some of them are genetics. Some of this dementia comes from the family. Some of them are lifestyle as well. Lifestyle that can bring on dementia at an old age. And some of them as well, like I said, with the genetics, it comes from the family. So when you go, when you get the genogram of the family, you can see that, some of them or the ancestors had dementia in the past, mom, dad, or uncle. So it's in the family. So no matter what, someone will get it in the family.
Okay, so my dad had it, so I should be careful, right?
You have to be very careful. Live a healthy life. Take more vitamins. There are a lot of vitamins that you can take that helps with the brain functioning, heart functioning. It's called omega-3, 6, and 9. It's very, very good. Yes. Healthy lifestyle.
In case you just joined us, I'm here with Vida Geja. She's a mental health assessor based in the UK, but in Ghana, and we'll talk about that in a little while. But she's basically talking about dementia and how to spot the warning signs and what to do. We'll talk a little bit now about how to actually prevent it, and then get to how to care for it for somebody who has dementia. If you have any questions for us, if the signs and symptoms that she has just spoken about resonate with you, you think you can see them in somebody in your family, you can send us a message on 055-556-1034. What do family members have to know about dealing with somebody who has dementia?
I think it's more to do with observation. They have to observe the signs and symptoms, and the moment they find these symptoms, what I would say is they should seek for medical attention. I know with us, sometimes it's very difficult because of financial issues and other things, but if they are able to get the right time, if I say the right time, just the beginning of the dementia, something can be done about it. Like I always say, I don't know about the health services here, but when dementia is detected at the early stage, there are medication that can delay the progress, and they'll be able to live a very good life without it tampering too much with their lifestyle. But when it's left too late, that is when it becomes worse and things, go wrong, and they are not able to enjoy life anymore. They are not able to eat. They are not able to remember their family. That means it's gone really bad. But at the early stage, when they start to become forgetful, putting things here, they can't find it, going out and finding it difficult to come home, those are some of the early stages where you have to, take action. And there are a lot of medication that can help. There are patches. They become very difficult when this dementia sets in. Even taking medication becomes a problem. So there are a lot of other ways, like some of the medication are in patches, where they can put it as a patch on their skin, where they wouldn't be able to take it off, like putting it at the back where they can reach, and that works very well.
It delivers the medication.
It delivers the medication into the system, and that delays the progression of the dementia.
Can stroke lead to dementia?
Oh yes, stroke can lead to dementia. Stroke can lead to dementia. When you have a stroke, part of the brain cells have started dying already. So with that, you stand about, I would say, 70 to 80 chance of getting dementia.
Okay.
Yeah.
So we've got to be careful about that.
We have to.
So it's common practice here that when old people start showing these signs, and they kind of think, okay, well, let's take them to a camp, a religious camp. Or now the witches camps and wizard camps have been banned, and so there was a law that took them out. But that's what people were doing in the past, which was wrong, right?
Very wrong. It's so sad that we are so naive when it comes to mental health, and that is the main reason why. I think the government should try as much to create awareness that there's something called dementia, which affects the older people, not just the older people, but the younger ones as well. So I feel the government should create the awareness of letting the public know that there's something called dementia, that they should watch out. And if it happens to a family member, it doesn't mean that the person is a witch or a wizard, but it is changes that has come into the brain due to age, and also I would say genetics as well. So we have to give them tender care, know how to look after them, seek for medical attention, have patience for them, because sometimes they are very, very difficult to deal with when they get this dementia. Their understanding is very difficult.
My mother suffered a lot dealing with my dad, may they both rest in peace. Yeah, we didn't understand what was going on in the beginning, but when we did, then we had more sympathy for him, more empathy for him, because we didn't understand what was going on.
What was going on, and that is why, unfortunately, people keep saying they are witches and wizards, which is very unfortunate. It's changes in the brain, that the neurons are not connecting, part of the brain cells die as we age.
How can we prevent or delay dementia? What are the things, some tips that we can do?
Okay, like I said, one, lifestyle is very, very important. I know we are Africans and we can't help it. Most of our food is carbohydrates, which doesn't really help, because these carbohydrates that we eat all the time turns into sugar, and then at the end you become diabetic. Although diabetes also, it's a genetic, but if we are able to eat healthy, because even diabetes, it gets to a point where it progresses, and then you get dementia due to diabetes.
So smaller portions of kenke and banku and
yes,
fufu
smaller portions,
diesel.
or eat it earlier so that it can digest, and
Throughout
then
the day.
exactly,
All
and
right.
then eat more veg and mostly vitamins, because we don't get all the nutrients and the vitamins that we need in the food that we eat. So we had to supplement it with some vitamins. That helps a lot. So vitamins, taking more vitamins, especially when you're aging, we need those vitamins to supplement the things that we are not getting in the system, and that helps a lot.
How about some of the myths around dementia? I want you to break some common myths that are around concerning dementia.
Sorry.
Yeah, you're watching #GTV Breakfast. My guest is Vida Geja, and she's a mental health assessor. We're looking at dementia, signs and symptoms, how to prevent it, how to manage it, and right now I want to talk about some myths around dementia. What are some of the things that people think about dementia which are wrong and have to be shattered this morning?
Okay, so when it comes to dementia, I would say that with we the Africans, one, the stigma. Because of the stigma, people don't come out to talk about it, that, oh, my mom is suffering from this, or I've seen changes in my mom. They try to hide it, just because people will be saying, oh, she's mad, oh, she's done this, or she's done that. And because of that, people are not really coming out for help. And that makes things worse. So I would say that if you see changes, and just like we are saying, they'll start saying, oh, she's a witch, he's a wizard, he's done something to somebody, and the person is taking him or her to, exactly, which is very, very sad, So I feel that if you see any changes in a family member, your auntie, your mom, your dad, who is aging, seek for medical help. Talk to somebody about it. Talk to any professional about it, and see how best they can help to delay it, rather than leaving it and keeping it a secret. And then one day you see the person going out naked, and that is where everybody will be coming out. She's a witch, she's a wizard, they want to kill the person, they want to, So I would say people should seek for attention, medical attention, seek for help. And by doing that, they will know how to help this person. I feel that, no matter what, there's some kind of little help that you can get in Ghana if someone is suffering from dementia.
Okay.
And that would help.
All right.
If they seek for help in time.
Quickly, can depression lead to dementia?
Yes, depression can lead to dementia. Recurrent depression. The only difference between depression and dementia, with depression comes on very easily and quickly. Within a week to a month, someone will be very depressed, depending on what is going on at that time with the person. It could be bereavement, it could be relationship breakdown, it could be financial loss, it could be anything. And with all these things, these are the things that trigger someone to be depressed. But with treatment, the depression goes away. Okay. But with dementia, unfortunately, dementia doesn't get better. It doesn't go away. The only thing you can do with dementia is you delay the progression of it.
Are there any alternative treatments, apart from like medication, that you can use to tackle dementia?
Unfortunately, with the dementia, the only treatment for dementia, which not really a treatment, is the delaying of it. And apart from that, they've got therapy. They've got therapies that they do that helps with the depression. With the dementia. So they've got different therapies. They've got CBT.
Cognitive behavior therapy?
Yes.
CBT, okay.
Yes. And then they've got like family therapy, where they can educate the families of how to look after them properly. So all those things help.
Okay.
Yes. But mainly, what really helps is the medication, which delays it, which is, they've got 3 different types of medication. They've got rivastamin, they've got, I can't remember the other ones, but they've got 3 different types that helps with the delay of it.
All right. What's the final takeaway you can leave somebody who is watching this show about dementia? What can should they learn from this conversation?
I would say they should learn from this conversation and seek for medical help as soon as they see any changes, seeing that the person is becoming forgetful, not remembering things, inappropriate behavior, signs of not being able to sleep properly, not being able to eat properly. All these signs, and with their age, should, give them some ideas that there's something happening, and especially if they realize that this is not the behavior of the person, and there are behavior changes, they should start seeking for help.
Okay.
Yeah.
All right. Vida Geja is a mental health assessor based in the UK, talking to us about dementia. But briefly, you were here in Ghana for what reasons?
Actually, I'm a queen at Kodiabe, a developmental queen. So the main reason why I'm in Ghana, I came here to screen for the people in Kodiabe. I did a 3 days health screening for them because I realized that most of them, due to finances, they are not able to go to hospital when they are ill. So I took that opportunity to give them a free health screening to see what's happening there. And to my surprise, about 80% of the population there were suffering from high blood pressure, diabetes, malaria. We did screen for all these things, typhoid, and thank God that we had the medication to give them treatment. So the little that I want to say is they don't have any government hospital facility there. What they have is a private hospital, and they are finding it very difficult to go to hospital when they are ill. So yeah, I would plead with the government to try as much to do something to help them, at least to get a government hospital which will be affordable for all of them to attend, because it was so sad that you see older people, most of them were not feeling well and they were not able to go to hospital. So please.
So good job for the screening. And next time you come back, add mental health screening as well.
I will.
Thank you very much. Vida Geja, mental health assessor, looking to doing some good work in Kodiabe area, and also talking to us earlier on about dementia. This segment was brought to you by Splenda and Splenda Stevia, who are here to give you that sweet taste you've been craving for without any side effects. So take away the sugar and the honey, and then go into Splenda Zero Calories and Splenda Stevia. Use that to sweeten your beverages, your cakes, your pastries, to live a healthy life. And for bulk purchases, call 0594-555-600 or 0200-127-380. With Splenda, you eat sweet with no health wahala. Talking of sweetness, here she comes with a dazzling and a very sweet
Liverpool one.
tamale flavored Liverpool spiced smile. She's wearing the appropriate colors, and she's got the sports news for you. Multi-T Saida Sadiq coming up right now with the sports. Do not go anywhere. This is GTV.